It's a Northwest lifestyle weekend on Como News. This is IRG's Health Talk. Back to Tom Hutler and Shannon O'Kelly.
All right, our next segment is with Dr. Stephen Gingrich, a sports medicine physician at Pacific Medical Centers. Lacrosse has become very popular, Shannon, even though, of course, right now high school sports are on hold. But this is something that's really taken a lot of away from other sports.
It is a very active sport, and a lot of running, a lot of stopping, starting, twisting, turning, and then you have those sticks that are banging each other and checking. In men's lacrosse, you can body contact. In ladies lacrosse, it's still activity, and so we're trying to talk about how to prevent some of these injuries. Again, prevention is worth a pound of cure, I guess. That's another one I remember.
Here's Dr. Stephen Gingrich and Shannon O'Kelly.
Dr. Gingrich, welcome back. Welcome to Health Talk, and thanks for joining us again. You came in several months ago, talked about some sports medicine injuries and different topics regarding tendon injuries, etc. You're back today. We're going to talk about lacrosse injuries. It's that time of year. Activities in the spring are happening. Lacrosse is one of those, boys and girls. It's a fast-growing sport. But before we get into the injuries in lacrosse, just bring our listeners up to speed about your practice and areas of interest in your practice.
Well, thanks for having me back, Shannon. My medical training involved a residency in physical medicine and rehabilitation, which is also known as physiatry. And I completed a subspecialization in sports medicine afterwards. I'm dual boarded at both in sports medicine and physical medicine and rehabilitation. My practice involves taking care of sports, musculoskeletal, and spine injuries that happen between the chin all the way down to the toe.
There you go. Musculoskeletal injuries. These are sprains, strains, fractures, you name it, bumps and bruises, but these are the type of injuries we're going to see in sports, and particularly in lacrosse. Tell us about lacrosse. They have unique injuries. I mean, it's a contact sport. It's an activity sport. It's stopping, starting, so a lot of different injuries in that area.
Yes, so lacrosse is a contact sport, particularly with men's lacrosse, less so with girls or women's lacrosse. The most common injuries that we see with lacrosse involve the ankle and the knee, followed by head injuries, including concussions. With the ankle injuries, it's often ankle sprains. It's the most common injury that comes in, as well as knee ligament sprains or strains. Occasionally we'll have concussions as well because people will collide either in practice or during a game.
And those players are pretty active with those sticks. I mean, we talk about men's lacrosse versus women's lacrosse. Men's lacrosse, they can make direct contact. It's a physical game. I mean, hits are big in that game. If you take that ball towards the goal, you're going to get hit, kind of like ice hockey and men's ice hockey, where women's lacrosse, they do a lot of stick checking. It's pretty interesting. So I imagine you see a lot of wrist contusions, a lot of finger fractures, a lot of things, because holding that stick and getting hit it's sometimes can be kind of a weapon.
Absolutely, Shannon. The other differences are that women's lacrosse involves less protective gear, so they aren't wearing real thick gloves to help protect their hands, and they don't wear helmets. They also don't wear any shoulder pads. So all those areas that are unprotected generally can be susceptible to injuries.
Let's talk about things starting with that ball hitting you or a contusion, a deep muscle bruise, which is, I guess in our world, we call that a contusion. I mean, some people call it a bruising. But let's talk about how to treat a contusion in a particular injury like that.
So the first rule is the player needs to protect the injury and go through a period of relative rest. And then after that, it depends on how bad it is. Oftentimes, we'll need to compress the injury and maybe add in some ice, particularly during the acute phase during the first day or two. And then after the first few days, we see how things play out. The deeper injuries may take a week or two or even longer to clear up, while the less severe injuries can allow the player to return back to action more soon.
And one of the things in our world, and particularly your world, as you're kind of managing these deep contusions or bruising, sometimes you have to watch it because on the other end, there are times where it develops in what we call myositis ossificans, which is a calcification of the muscle, which can be problematic in a 14, 15-year-old.
Yeah, you don't want that to develop. So it's really important to get on top of these early. And then if they gradually improve over time, then that's good news. Hopefully we don't get to that point.
And the interesting thing about myositis, I mean, there's a little bit of controversy in the treatment world. I mean, do you rest it? Do you treat it? Obviously, the player is not playing, they're sitting, but it takes some time for that thing to heal.
Correct. So it's still unclear in terms of which players would benefit from relative rest or early activity. But yes, you're right. There's definitely a concern about that developing.
Back with Dr. Stephen Gingrich, Shannon O'Kelly, right after this time out on Como.
It's a Northwest lifestyle weekend on Como News. Now back to IRG's Health Talk.
More of a conversation with Dr. Stephen Gingrich and Shannon O'Kelly on lacrosse.
Dr. Gingrich, again, thank you so much for joining us. We're talking about lacrosse injuries. We talked about kind of a contusion or a bruise. So let's talk about a sprain and what is a sprain as it pertains to the tissue type and the treatment and recovery.
So all of our joints are stabilized by ligaments, and ligaments are structures that are kind of like tendons, but they only connect bone to bone, and we refer to those as our static stabilizers. So whenever we're not moving, we rely on our ligaments to provide us some stabilization. A sprain happens when one of those ligaments gets partially torn, but not fully torn, and that's what happens when you have an ankle sprain. When you twist your ankle to one side, you stretch that ligament out into the point where part of it no longer is able to function.
I mean, these are soft tissue injuries, and when should you see a physician like yourself? There's a time where this maybe needs more attention than just at home with rest, ice, compression, elevation.
So these commonly hurt pretty quickly right after the injury, and oftentimes they're accompanied by swelling, and oftentimes, especially if it's a weight-bearing joint that's involved, the player is not able to place weight on it, or if they are, they're very ginger with it. It's sometimes really difficult to determine how bad it is right away, so it's good to get on top of it and protect the area and maybe rest a player till we see how the injury develops. Over time, most ankle sprains will clear up within a week or two, but some of these can last for several weeks to several months. It depends on how bad the injury is and how well the player is rehabbed.
And sometimes, I mean, if these things are not resolving in 4 to 6 weeks where they linger and you're saying this probably should be resolving by now, and then they do an x-ray or maybe a more in-depth diagnostic test and there's an avulsion. There is a piece of bone that has been torn off. The ligament's intact, but the bone's torn off. Let's talk about avulsion fractures, particularly in adolescence, these kids that are growing and developing in their growth plates.
Right. So in young folks in adolescence, the weak point is actually not the ligament or the tendon itself. It's actually where the bone is growing or the growth plate, and we call these apophyseal type injuries. So in someone that's skeletally mature, generally we would see tears. In the young people, we see avulsion injuries, and there's some really common ones that we see. For example, Sever's disease, which happens at the ankle, Osgood-Schlatter, which happens at the knee just below the kneecap, and also there's a special one that happens right at the kneecap called Sinding-Larsen, Johansson's disease, and all these are referring to the same process where a piece of the bone where it is gradually growing over time is weakened or is in a weakened state because of that and gets pulled away.
And so, I mean, to identify these, I mean, typical x-ray or at times if this pain lingers and your athlete or your child is not getting better, but they had this sprain, is it a CT scan, MRI? What's the best way to kind of identify this little avulsion?
So generally, X-ray is sufficient to identify it, even if it is not shown on an X-ray. If there's tenderness over the apophyseal area or the growth plate, we assume that's a fracture until otherwise.
I mean, the reality is, I mean, if these things are identified early and treated by someone like yourself and caught, the treatment is usually successful and return to play, and the athlete and parents, coaches, everybody's happier, but it's got to be return to play at the right time.
Correct. If we put the player through appropriate rehab and recovery, then we can get him back as soon as possible.
Excellent information, Dr. Gingrich. Again, welcome, and thank you for your time.
Thank you.
All right, that's been Dr. Stephen Gingrich, sports medicine physician at Pacific Medical Centers, talking about lacrosse specifically. But Shannon, of course, in any of these youth sports, injury prevention is something we're always trying to stress.
Particularly right now when young athletes and even older athletes don't have access to maybe gyms. You know, you have to stay in shape if you're preparing for activity. We know that as a fact.
All right, final segment of the show coming up after this timeout on Como.